2 weeks ago, the Uganda Police Force released a video that went viral online, showing cutouts from the police closed-circuit cameras installed on major roads in the Kampala metropolitan area. In the video, a number of Boda riders were at fault in all scenarios, leading to accidents for failure to observe traffic guidelines. This incident was at Nansana Big Zone. Then this at Kisugu. These scenes are repeated on almost every road across the country, and some are too graphic to be shown on TV. The Police Annual Crime and Traffic Road Safety Report of 2021 shows that of the 4,159 road accident fatalities countrywide, 1,390 were motorcyclists, while 528 were passengers on motorcycles. At least 6,770 motorcyclists and passengers suffered serious injuries during the accidents in 2021. UBC TV visited Mulago National Referral Hospital, where many of these fatalities end up. This is the accident and emergency ward at the hospital. The victims in this ward have their bodies covered with blood-stained bandages and look frail. The ambience is filled by wails and cries of those in need of the doctors' and nurses' attention. This place is called the Casualty Ward at Mulago National Referral Hospital. Majority of the victims here are admitted with facial injuries, chest, broken necks, and fractures. Health personnel have them graded and given color codes.
Red, yellow, and green. Red are those who are very critical. Yellow, they are not critical, but they warrant admission, investigations, and other interventions. The green are those who are able to walk, and we mostly discharge them. So the commonest injuries arising from these cyclists affect the brain, the chest, the abdomen, and the long bones. The long bones are those bones of the lower limbs and the upper limbs.
Those in critical condition end up at the hospital's intensive care units. Here, the silence is peculiar, by the steady beep of machines doing what patients admitted can't do, that's breathing. Some patients have been in coma state for months now, and majority are Boda accident victims. Dr. Jane Nachibuka is the senior consultant physician and head of the ICUs at Mulago National Referral Hospital.
So Boda accidents, unlike other accidents, the patient is really exposed. So they get head injuries, and they can also get injuries on any other part of the body, including the neck, the limbs, so they can fracture the chest. So they are really multiply injured. And they are one of the commonest long-stay patients in the ICU. So they could stay anywhere between 9 days to even 53 days. And because of that, their care is rather very costly.
The situation is not different at the hospital's orthopedic unit.
This place admits patients every day. At times, it's filled up to capacity, and we even have more than the normal number we can take. And the biggest ailment we have here is trauma. Trauma resulting in fractures. So we spend a lot of our time treating patients with fractures.
Numerous accident victims being managed share their tribulations.
Motor rider was overtaking, and I was on my side, but I tried to save myself going away from the main road to the reserve. He even followed me there. He knocked me. So from there, I just stopped understanding from that time.
Speed kachedeza akwa kali buleba ati kila buteregobe yageta budabeho kila yosere budabeho ati kokoja speed kwenda gushara speed ati dawa ko kurosega budegubwe tukabitigarwa gati yorukuta.
Many Boda accident victims present with head injuries, and Dr. Edward Muhumuza, one of the country's top neurosurgeons, says sometimes they get overwhelmed.
These are kind of patients whom we spend with, who can take 3 to 6 months in hospital. Also, when they survive, the quality of life, what we call the Kanofsky performance score, is usually very poor, or the GCS.
In the surgical outpatient unit, our attention was drawn to a Ssenono Hamidu, a passenger who was involved in a Boda accident along the northern bypass. He is currently recovering from the multiple injuries he sustained. The stutter in his speech, however, is an after effect.
At first, I was unconscious. By the time I came back to my senses, I was in the hospital in Chigo. It is called I failed. Then after they transfer me to the here. But by then, I couldn't even speak. Actually, I couldn't speak. Instead, I could just write whatever I wanted because I couldn't speak. I could understand you or recognize you, but I couldn't talk to you. I couldn't even say your name.
When you count the cost of treatment for the accident victims at Mulago National Referral Hospital, the burden is evident, and hospital authorities are now calling upon relevant authorities to act.
It's very expensive. Those with fractures, they need surgery to fix the fractures, and probably they need implants which are very expensive, which range from like 2 million to 10 million an implant. And how many Ugandans can afford to buy those implants? Later on, the cost of care, surgery, the time you spend on the ward. Then what we normally forget to cost is the lost productive life. And then with recovery, of course, you do not recover to go back to your original state.
Police has in the recent past heightened operations aimed at solving this malady, but a lot still needs to be done.
Made people aware that indeed bodas are a high-risk vessel of movement. And it is absurd that sometimes they have passengers aboard. And these are innocent people, but although sometimes I wouldn't say they're very innocent, because they permit boda riders to ride them in a very dangerous manner. And I would think it would be prudent upon the passenger on the boda, to caution the rider.
The profiles of those admitted and being managed at the wards we visited are telling. These are mostly energetic young men, the time they spend recovering, and that the country loses not having them as productive members in society can never be salvaged. Ssenono, UBC News at Mulago National Referral Hospital.